Just as the heart and kidney share the heat and cold distribution, the spleen and lung share the damp and dry management of the body. There is a fine line between thin and thick fluids. If the thick fluid becomes excessive, we suffer various damp symptoms of the body and in the lungs and skin. The thin fluid becomes deficient, not only is there general exterior dryness, but also the thick fluid becomes thicker, making it difficult to expectorate or disperse them out of the skin, creating the possibility for heat illness or inflammation. The climatic dryness affects the lungs and large intestine adversely. It helps damp illness of these organs. When patients complain of dry cough and thick mucus, it is useful to humidify the living rooms so that they inhale the humid air. When the skin is dry, they should use some simple moisturizing cream and a wet sauna. In both cases, they should drink more water and consume salt in their food regularly. It is very interesting to ask this patient to draw any picture that comes to their mind. The person with claustrophobia will draw an open space, forest, field, beach, etc. without any borders. Those with agoraphobia will draw a confined space, house, and garden with a thick fence, a picture with a broad border all around the paper, always highlighting the border or the frame. We go to the large intestine, the decoupled young organ. Between the lung and the large intestine, the latter is more active hollow organ. It is also more important eliminating organ. Problems of the large intestine must be taken extremely seriously and treated until well-being is restored. It is normal to have 1 to 2 stools per day. The stools should be well-formed and chestnut brown by certain foods. There should be no pain before, during, or after defecation. Abdominal distension is only normal after eating pulses, cabbage, or raw foods. Next, diarrhea. Diarrhea or watery stool could be the result of spleen Qi deficiency or imbalances of the small or large intestine. Spleen Qi deficiency has symptoms of its own. No hunger for breakfast, but around 11 a.m., tiredness after eating, heaviness of the limbs, lethargy, edema in extremity, etc. The watery stools are generally worse immediately after meals due to malabsorption. The stools will contain undigested food and be of lighter color than usual and rather frothy. Malabsorption diarrhea is a chronic symptom and can cause malnutrition over a period of time. It improves with eating cooked and warm foods in small quantities which are easy to digest. The small intestine has an important function of absorbing fluids. In both yin and yang dominant states of the small intestine, there will be a watery stool. So we have here at our diagram, small intestine, there is an excess of yang or excess of yang deficient yin. So this is an acute Crohn's disease or appendicitis, colic, or severe intermittent pain around and below the navel, radiating to low back and thighs. There is urgent watery stool and wind relief pain for a short while. Coffee, strongly flavored foods, and activity worsen the pain and diarrhea. Resting, eating bland food makes the diarrhea better. Worst time is noon. Yellow, slimy coating on tongue color more red, and has a bad breath. Pulse, full, rapid, and slippery. So sa treatment, we use stomach 39, sedation, stomach 25, REM 12, stomach 37, sedation, and do 20. During acute pain, eat toasted white bread and clear salty soups, chamomile tea, and rest. Sa small intestine, there is normal yin, deficient qi. Chronic malabsorption syndrome, there is a constant dull pain around and below navel, dull low backache, abdominal tension, but cannot release wind. Black coffee or a little brandy could help with the pain and distension. Keeping busy, eating warm, cooked simple food helps the pain and watery stool. Worst time, night. White slimy tongue coating and pale tongue. Pulse is deep, slow, and slippery. Sa treatment, we use REN8, moxa only. Sa points, stomach 28, stomach 37, and stomach 39. REN12, UB 27. Always eat warm and cook small, simple meals, warm drinks, no raw food. With the large intestine, the symptoms is more often a young dominant diarrhea, either due to colitis or irritable bowel. The stools are dark than usual with much wind and water. Sometimes also pus or mucus and stink. There is usually severe colic on either side of the navel, the left side worse than the right. There is anal pain while defecating. Symptoms may be recurrent and when bad several times a day and can cause dehydration. It is necessary to eat carefully during acute state, eating bland, simple foods such as toasted white bread and chamomile tea. Patients should avoid spicy flavored foods and coffee, food dried in oil, and large meals. When the patient has a chronic diarrhea with recurrent episodes, their large intestine yin is deficient and the yang increases from time to time when there is a reason for this increase. To prevent a bowel infection from turning chronic or in case of recurrent situation, it is always a good idea to tonify the large intestine yin. So the treatment points to treat large intestine yang excess diarrhea, stomach 25, which is the move point of the large intestine, which cools and calms the organ, tonifies yin. Sedate stomach 37, lower C point of large intestine. When sedated, sedates yang. And REN12, the influential point of yang organs. Okay, we go to the lower C point. All meridians have their own 5 element points, which are called by names of water sources. The points of the finger or toes are the well points or the jing, and the points of the elbow or knee are the C points. The well points of the meridian are useful in the treatment of superficial diseases of the organ system, and the C points are used in the treatment of the organ itself. Points stomach 36, UB 40, GB 34 are all used in their organ dysfunction problems. All meridians flow on their respective organs, excepting for the 3 young meridians of the arm, large intestine, small intestine, and triple wormer. When treating the dysfunction of these 3 organs, their upper C points, LI11, small intestine 8, and triple wormer 10 are not as effective. Therefore, additional points have been chosen on leg meridians and are used for organ symptoms. These additional points are called lower C points, as their meridians already have their own C points on the arm. So these points are the stomach 37, the lower C point of the large intestine, upper C point, LI11. Stomach 31, 39, the lower C point of the small intestine, upper C point, small intestine 8. UB 39, the lower C point of triple wormer, upper C point, triple wormer 10. They can be used to improve the function of organs when applied as tonification and calm the function or disperse the heat when sedated.